thank the distinguished Representative McNaughton for his statement. I now have the pleasure of giving the floor to the distinguished delegate from India, Mr. Sudarsana Nachiyappan.
Thank you, Chairman, sir. And I thank all the members, delegates. In order to control the spread of HIV/AIDS, the Government of India is implementing the National AIDS Control Program, a centrally sponsored scheme. Its policy framework is anchored in the National AIDS Prevention and Control Policy 2002. The focus over the years has moved from raising awareness to behavioral change, from a national response to a more decentralized response, and to increasing the involvement of NGOs and networks of the people living with HIV/AIDS. Phase 3 2007-2012 of NACP, currently being implemented, is evidence-based with well-structured policy, programs and schemes with operational guidelines. Launched in July 2007, it has the goal to halt and reverse the epidemic in the country over the 5-year period by scaling up prevention efforts among high-risk groups and general population and integrating them with the care, support and treatment services. Prevention and care, support and treatment form the two key pillars of all the HIV/AIDS control efforts in India. These are being achieved by behavior change, communication for improved awareness, upscaling targeted interventions among the high-risk groups, expanding counseling and testing services, condom promotion, management of STI, RTI, support and treatment of HIV-infected persons, including the treatment of opportunistic infections, provision of antiretroviral drugs, and mainstreaming of HIV intervention strategies. Strategic information management and institutional strengthening activities, providing support for implementing these core activities at national, state and district levels. HIV epidemic in India is a dual epidemic driven by sexual and IDU routes of transmission, concentrated in nature with high HIV prevalence among high-risk groups, injecting drugs users 9.19%, men and who have sex with men, MSM 7.3%, female sex workers 4.94%, sexually transmitted infection clinic attendees 2.46%. Compared to this, the prevalence among the ANC clinic attendees, that is pregnant women proxy for general population, is much lower, 0.48%. Therefore, prevention through focused interventions among these groups is of extreme importance for controlling the HIV epidemic. The current estimates highlight an overall reduction in the adult HIV prevalence from 0.41% in 2000 to 0.31% in 2009. The estimated number of new annual HIV infections have also declined by more than 50% over the past decade, from 2.7 lakh new infections in 2000 to 1.2 lakhs in 2009. Ensuring prevention services to most at-risk populations is key strategy of the program. The most at-risk population includes female sex workers, men who have sex with men, transgenders, and injecting drug users, and in addition, bridge population like truckers and migrants implemented through NGOs and CBOs. Over 1,600 TI programs covered 80% of FSW population, 76% IDU, and 69% MSM population. 3 interventions provided package of services aiming at behavioral changes, STI care and condom, and a safe needle practice. NGOs and CBO are played as a significant role in this complex intervention. The program has a robust mechanism to ensure quality of services for ensuring national goal of prevention and control of HIV among these groups. Counseling and testing services. In India, HIV counseling and testing services have been upscaled from 4,037 in 2007 to 9,993 in the year 2011 in order to ensure access of counseling and testing facilities to all at-risk population. This also includes 1,018 ICTCs under public-private partnership model facilities in private hospitals and maternity homes to ensure counseling and testing facilities in the private sector. Every year, about 17 million people access these services for knowing their HIV status. The prevention of parent-to-child transmission intervention is working towards the elimination of mother-to-child transmission. PPTCCD coverages have scaled up from 2.3 million in 2007 to 6.8 million in 2011. The plan for further scaling of NACP 4th is from 6.8 in 2011 to 14 million in 2017. India is moving from single-dose nevirapine to the more efficacious regime for prevention of mother-to-child transmission, which will further reduce the transmission of HIV from mother to child. The NACP has an integrated approach between counseling and testing facilities and STI, RTI services, care and support services. By providing these services, out of 2.4 million of estimated HIV infections in the country, 1.67 million have been registered for treatment and care services. Of the 1.67 million people registered in ART, 475,000 are on ART through a network of 330 ART centers in the country. In view of the large size of the country with a wide geographical area, a concept like ART center was evolved to provide care and support near to beneficiaries. 678 such link ART centers are set up in the public health facilities in the country. In addition, 253 community care centers are linked up to ART centers for adherence, counseling and follow-up, etc. Government of India had rolled out second-line ART services through 17 centers to provide ART services to resistant patients. The program has provided high priority to pediatric HIV. Children less than 15 years account for 3.5% of the total number of people living with HIV/AIDS in India. Nearly 95,000 children are registered out of 27,597 are receiving free ART. Since 2006, about 4 lakhs people were added to the pool of PL, HIV and ART, and it has been planned out that by 2017, number PL, HIV and ART will be doubled. By implementing these activities, a significant progress has been made in MDG goals as follows. 1. There is 50% reduction in the new infections in the last decade, aiming at halting the epidemic and begins to reverse. 2. The prevalence of HIV infection among pregnant women in the 15 to 24 has been declined from 0.86% in 2006 to 0.48% in 2009. 3. Condom use rate with non-regular partners has increased from in 59.1% 2006 to 61.7% in 2009. All the above achievements were possible because of the active support and participation of various stakeholders and involvement of various ministries, departments in the government, including education, home affairs, women and child, social justice and empowerment, rural development, youth affairs and sports, Panchayat Raj, roads and surface transport, etc. The program is presently working out the priorities to enable to reach the goal in line with political declaration, especially ensuring the universal access to prevention, care support and treatment. Thank you.
Thank you, Secretary of India, for his statement. And now I have the pleasure of giving the floor